Okay, so we'll make a start as we're on the hour now. So hello and welcome everybody to our webinar today. It is brought to you by mockosce.com and we will be talking all things OSCE, so preparing for an OSCE with a special focus on communication skills. So my name is Gabia and I'm the educational psychologist here at mockosce.com, and I will be joined by our lovely patient actors. So we have Matt Avery, Mariana Spagadoros, Sarah Beckett, and then myself. So we'll get to hear from our actors in a little bit, and they'll give you all the tips and tricks that they have. You'll all be on mute for the webinar until the very end when we get to our Q&A session. So please make note of any questions that you may have, and we'll answer them as best as we can. And those of you who will stick around till the end, we also have a little discount code to share with you for a mock OSCE. Now, so I'm going to open up the webinar by talking a bit about communication skills and why they're so important. So we can see that poor communication skills are a common complaint among patients, taking up 35% of all complaints to the medical council. So it's a fair bit. It's also important to note that communication skills do tend to decline throughout the years for both medical students and physicians. And this could be due to a lack of practice or even burden of long hours or stress from work itself. Many doctors may feel that, it might take up a lot of time during the consultation to take in a lot of information, but essentially these factors do negatively impact patients because it decreases empathy and appropriate bedside manner. So good communication skills pose many different benefits, including empowerment of patients. So when we empower our patients, it lets their voice be heard, and this not only brings us closer to them, but it also builds a good reputation for the physician. Conflict resolution, there are many different feelings that may be expressed, anger, sadness, throughout a physician's career. So it's very important to be able to de-escalate these situations by letting patients voice their concerns. Beliefs and trusts, always try to understand something from the patient's perspective, such as asking them to summarize what they understand. And patient satisfaction, the higher the patient satisfaction, the more likely they will return to the same physician. So it's very important to keep these skills intact because they do get lost if they're not practiced. And better communication leads to fewer complaints and malpractice suits, but it also helps detect problems early. So we're not really wasting time by letting the patient speak throughout a consultation. So this is a very interesting figure from a study among orthopedic surgeons and their patients. So 75% of physicians thought that they were communicating appropriately with their patients, whereas only 20% of patients felt that way. So it's a very interesting statistic to keep in mind when we are talking about communication skills. Okay, so everybody here is well aware of what an OSCE is, but just to kind of share a little overview as to why it's still kind of widely used around the world. So it was introduced in the first place to examine performance-based assessments, and that includes communication skills. It's regarded as an acceptable instrument for both undergraduate and postgraduate levels, and it's verified as the most reliable and valid tool for assessing competencies in many different settings. So it's still widely used in many universities around the world. And just a little overview on the Calgary-Cambridge Guide. This is an educational model that is used in medical interviews to logically organize consultations. This one in particular is used because it's been shown to significantly improve interviewing skills. So we can see here that it has 5 different phases, and then providing structure and building a relationship, the 2 arrows going down along the sides, they're kind of interweaved throughout the consultation, and you kind of expect to see that throughout the duration. Having models like this is very important because the ordered stages allow medical students and medical professionals to accomplish their goals and achieve sufficient patient care. So it's great to have a guideline like this when we're practicing in our course in medicine, but even when you're a practitioner yourself. So we'll move on to our actor session. So first up, we have Matt. So if you'd like to introduce yourself and give us your background experience before you get started.
There we go. So I'm Matt Avery. I'm one of the patient actors. I've been doing this for over 20 years now, and also lecturing in communication skills at Southampton University. And the reason I got involved, first of all, was I'm an actor as well, but I still do this because I believe passionately about it, that communication skills are so important, that if you can communicate well with your patient, you will get a far better experience for the patient and for yourself, and better information. So it really does work. And the thing I want to talk about first of all is preparation. My colleague's going to talk about what happens when you're actually in with the patient, but preparation is key, because you can have all the knowledge in the world, but if you can't communicate effectively, or if your mind goes blank when you're in the OSCE or with a patient for real, well, then it's all for nothing. So looking confident is really important. It's important for you and it's important for the patient. And that's something you can get used to by practicing in advance. Now, if you look confident, that will inspire confidence in you. And the patient will have confidence in you. They will relax. And if they relax, they will open up about their problem. And when they open up and you get all the relevant information, that gives you confidence, which helps you to relax, and so on. It's a virtuous cycle. You may be familiar with the Batari box. If not, I suggest looking it up. But basically, it sort of says that your behavior will affect your patient's attitude, and their attitude will affect their behavior, and your patient's behavior will affect your attitude, which affects your behavior, and so on. So looking confident is really important. And the better prepared you are, the more confident you'll be. So to start with, preparing yourself and your workspace. So you can give yourself a huge advantage simply by planning and getting ahead and getting the practical details sorted. So for instance, choose what you want to wear. Make sure it's washed and ironed. Make sure it's ready to go. Don't leave those to the day of the OSCE. If where you're doing the OSCE is in the real world, obviously some of it's virtual still these days, some of it's back in the real world. If it's in the real world, make sure that you know where you have to be if it's somewhere you're not familiar with. How are you going to get there? How long does the journey take? Where are you going to park your car? All those sorts of things. Just get all the practical things squared away so you eliminate any surprises on the day. If it's virtual, then make sure that your workspace is free of clutter. Make sure you've got a neutral background. So a plain wall works well. If not, a blue screen or a green screen like I've got. They're very cheap these days. Get them on the internet. Makes all the difference in the world. You've no idea what's the other side of that screen. A complete mess, but it doesn't matter. All you see, this is what you get, what I am here, and that's it. Looks professional. So that's really good. Make sure that your camera's set to the right height and that you're large enough in the frame. Check your sound. Check the internet. Do you need an Ethernet cable? All those sorts of things can make all the difference, not only to your experience, but to the way you feel about your experience. And then try and get a good night's sleep. I know it's not always easy when you've got a big exam coming up, but do the best you can for a good night's sleep. And then on the day, make sure you've had something to eat and drink. Try to avoid too much caffeine because you'll be wired and need to keep running off to the loo. Make sure you've got a glass of water to hand so that you don't dehydrate. That's really important because it's bad for the voice. Not only does it make you feel bad because you get tired and thirsty, but it's bad for your voice. And your voice is your tool. You've got to communicate. You've got to keep talking and keep being engaged and keep being engaging to your patients. So you need to make sure that you look after your voice. You might want to have something like Vocal Zone. That's the one that all the actors use. It's a sort of medicated lozenge, just over the counter, but that's a really good one, or any of those other sort of throat sweets can really help. Make sure you've got a healthy snack to hand so you don't get hungry during it. And then do some stretches. Now, this might be alien to some of you, I don't know, but do some stretches, because these will release tension in your body and in your throat, and they will also get you energized. So some facial and some vocal warm-ups, brilliant for honing the concentration as well, and getting nerves under control. And if you're not familiar with what those might be, I'll show you very simple exercises now. Now, you might not want to do these in front of your patient, by the way. You might want to go away and just go to the loo or something for a couple of minutes. But scrunching your face up really, really tight, and then really big, and then really tight again, and really big. And what you'll find is that the tension just starts to drain away from your face. It's absolutely brilliant. It's really, 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 really quick. It's really quick and really easy. And if you want to warm up your voice, the quickest and easiest thing is to vocalize some yawning. So just start yourself yawning, and then just a gentle sort of sound to it. So you just start yawning, and then there you are. You all get to see down my throat as well. So there you are. It's an extra bonus. But that really does work. That really works for opening up the throat and relaxing the throat. And the more relaxed you are, the better you're going to do. Box breathing is another thing that we recommend. So box breathing is very, very simple. There are four sides of a box. So you breathe out for 4 seconds, breathe out through your mouth, and then you hold that for 4 seconds. Then you breathe in for 4 seconds through your nose, and you hold that for 4 seconds. So the whole thing only takes 16 seconds. So do that a couple of times, and your heart rate comes right down, and you feel much more relaxed. And remember, these are things that you can do every day in advance of your OSCE. You can be practicing them every day, so that they're second nature to you, and you develop a really good routine. So by the time the OSCE comes, it's really, really easy for you. You're just finding you do it automatically. And it gives you a chance to discover what works best for you. You've given yourself time. And then, of course, you can use a quick version of these between each patient. So as I said, my colleagues are going to talk about what to do when you're with the patient. But between each patient at an OSCE, you'll get some time to read the notes. And in that time, whilst you're reading notes, you can be breathing effectively. You can be screwing up your face and relaxing it. You can be doing all these exercises to keep yourself relaxed and energized and in the right zone mentally. And that's going to keep you calm and focused and give you the best chance of success. Thanks, Gabrielle.
Thank you very much, Matt. Okay, so moving on to our mid-OSCE or during the OSCE itself. And I'd like to present to you Mariana. And again, if you could give us your background experience before you get started.
Great, thank you, Gabia. I am Mariana, and I've been involved in training and higher education at both postgraduate and undergraduate level. So I've been involved in simulation, working with standardized patients, and many, many OSCEs. I'm also a registered nurse, so I myself have been through many of these OSCEs, and I know the anticipation and the feeling. We know that as healthcare professionals, that communication, effective communication, especially within an interview process or situation, is your underpinning baseline for gathering data from your patient. So it's the first entry point where you get to know your patient and you start to build that rapport. So having effective and a good understanding of how to communicate effectively is really so important. And so especially during an OSCE when you're nervous, gathering all this information will help you to build that rapport with your patients. So first of all, we know how important communication is and interviews. And so first impression is last. We know that age-old saying. And so just as much as you've set up your physical environment, you've prepared yourself for this encounter, your first encounter with your patient will set the tone for the rest of the interview. So your initial chat is important, and this will, as Matt has said, your behavior will affect your patient, which will inadvertently affect you. So it is vitally important that you, as the healthcare practitioner, gains a trusting environment, a safe, sound environment right from the get-go. Create a welcoming environment. So things like where you sit within the room, how you position yourself. Obviously, we don't do handshakes and things like that, post-COVID. So asking a general distracting type question when you greet them, making eye contact, having them feel welcome, talking something sort of media like the weather, there's been a sudden temperature drop, or did you find the place quite easily? Or how was the public transport on the way here? So something sort of very generalized and distracting in a way for that first encounter, making your patient feel welcome. Then you can move on to your the main part of the actual interview, where you will start your active listening. So it's important that your patient leads the discussion and leads the interview. Remember, sometimes we want to be in control, and although you are in control of the timing of the interview and the stages of the interview, the initial stage, the gathering of data, and obviously the ending off in the conclusion, let your patient lead the interview by using your active listening skills. So active listening skills, again, we mentioned your eye contact, nodding, and just showing them that you're not going to interrupt them and allowing them that safe space to express the reason that they've actually come in to see you. All right, so again, we said first impressions is last. Now, we often forget about things like body language, posture. How are you sitting? Are you sort of slumped down? Are you not really interested? You kind of looking at your notepad. You're looking at your script pad. You're thinking about what you have to do next. You're thinking of your next patient. You're distant. You've got your arms folded. Or that picture. I mean, if I had to come, if I was a patient and I had a medical professional sort of sitting like this, leaning, it gives an impression to your patient that you're not really interested. It's also unprofessional. And it also, a closed body language will create a fearful atmosphere for the patient. So if you as a medical professional is closed off, non-engaging, focusing on sort of writing down the notes, which we have to be cognizant of. You could be in your OSCE, you could be in your clinical interview making notes, which is fine, but try to find a balance between being closed off and still maintaining an interest in writing down what the patient is saying to you. So sometimes this could be a bit tricky, but keep your body language neutral, avoid crossing legs and arms, open, neutral, sit upright and lean slightly forward, showing your patient that you are actively listening and that you are interested while taking a few notes here and there. Right, so as much as your body language is very important, remember also things like your behavior. So tone of voice and your behavior. So things like use of hands. Some of us are very expressive with our hands. So this could be a little bit distracting to your patient if you're overusing your hands when you talk. So just be aware of that. Things like we might not realize, but our tone of voice, how we come across, how are you projecting your voice? If you are speaking with your voice down, your head down, and your patient can't actually hear you properly, so you're not projecting properly, there might be certain words that you're using that the patient may have not heard before. So you need to project your voice and you need to be able to speak clearly and enunciate your words. So, for example, if your patient has to keep asking you, excuse me, could you repeat that? What if you said, I didn't hear you? It creates an atmosphere where the patient could feel closed off, non-engaged, a little bit intimidated to keep asking you to repeat yourself. They might feel silly, sometimes if you've got to keep asking, maybe the medical professional thinks that you're silly, that you're not listening properly. So create an atmosphere that you're using your voice clearly for your patient. Make sure your voice is gentle but secure. Also, when you fluctuate your voice and your tone, for example, sometimes we're in interviews where maybe you're dealing with a teenager or a young woman that is discussing her sexual history or her sexual health. Or it could be a sensitive interview. There could be certain questions that you have to ask, and your tone of voice in response to the answer is vital, because this could set the tone of your patient providing more information to you, or it could set the tone for them closing off. I'll give you an example. If you have to ask a question, for example, how many sexual partners have you had? And maybe the patient says, I've had 25. And you say 25, so your voice goes up, your tone goes up, and it automatically gives your patient a judgmental tone. So something as simple as a voice fluctuating and your pitch fluctuating could change the rapport of your interview. Your patient will shut down and say, ooh, that's a lot, or there's something wrong with that, Again, the opposite, so a monotonous, low-pitched voice is very, very boring for your patient to listen to. It becomes uncomfortable. So let's be aware of our tone and keep it gentle but secure. Another aspect, which is mirroring, so mimicking behavior. So a lot of research has actually been done, and they've gotten a lot of data that you as a health professional, if you mimic the patient's behavior in a subtle manner throughout the interview, it unconsciously creates a sense of belonging, and it slowly, in an unconscious way, non-verbal, builds the rapport. Obviously, if your patient has got sort of distracting mannerisms, you don't want to mimic that. But if they're sort of sitting back, or if they're sitting in a relaxed manner, if they're keeping their legs uncrossed or leaning forward, you will mimic those behaviors to create a sense of belonging. And it really does work quite well. All right, so the next section is our questioning styles. So, continuing with our gestures. So I've already spoken about your hand movement and the talking with hands. You don't want to overdo that. Sometimes when we're nervous during OSCEs or in interviews, we might have unconscious habits. So scratching our nose. Women might want to be doing our hair all the time, checking our earrings. Try to avoid this. And a tip that I say sometimes is just put your hands together. So keep them together, or put them flat on the table, still maintaining your open body language. Don't fold your arms. Just keep your hands together, crossed, to avoid any automated or unconscious habits. We also might have other unconscious habits like over nodding, but sometimes a nod or a tilt of the head can be a non-vocal affirmation or a vocal affirmation. So just letting your patient, without interrupting their thought processes, but allowing them to know that you're listening, you're taking in what they're saying, and what they're saying to you is important. Because remember, an interview or a clinical interview is your patient telling you their story. And sometimes a lot of emotion can be built up. So a gentle nod and a head tilt tells them that you're actively listening and you acknowledge what they're saying. Then lastly, part of gestures is your facial expression, so your smile. And a lot of research has been done, and they've come to a type of smile called the Duchenne smile. And this is dubbed a real smile. So something that is sincere. It creates a sense of care and comfort towards your patient. And so sometimes we don't want to come across with a false sort of artificial, maybe even scary smile towards our patient, when you sort of like a Cheshire cat. So have a look in the mirror. I would really advise you to talk to yourself, conduct an interview in a mirror, and have a look at your facial expressions. Have a look at how you smile. How do you position your mouth and your eyes? Is it close enough to the Duchenne smile? All right. And then most importantly, once you've got your body language and your gestures all intact, we move on to actually gathering the data, and this would be our questioning styles. So we know we've already had our first question where you asking about the weather, or how did they arrive? Did they get here safely? How was the public transport? And so that is your breaking of the ice or distraction type question before you get into the clinical questions. You need to keep 80 to 90% of your interview open-ended questions. We don't want closed-ended questions that just allow your patient to provide yes or no. So for example, if you ask your patient, do you have pain? Yes, I do. No, I don't. That is not really telling you much about the clinical situation of your patient. So you want to stick to open-ended. Open-ended is how, why, when, what, and where. So a nice open question is, what has brought you in today? What is the presenting complaint that you have today that has brought you in to see me? That is a nice platform to start off. And then you piggyback your open-ended questions from that main question that your patient has told you. Keep it uncomplicated. Try to be specific, but not too focused. If you keep your interview very sort of direct and focused, it could come across interrogating towards your patient. Minimize jargon. So we know that you're really clever, you know all these medical terms, but your patient doesn't. So using these highfalutin, complicated medical terms creates a sense of confusion, uneasiness, and fear, because your patient might think, oh my goodness, what do I have? And it could be something very, very simple that you're trying to explain. So minimize jargon and use colloquial language to your patient. And then lastly, something that we don't always do, I know sometimes I like to fill the silence, but silence is a very effective tool. It creates a sense of pause, telling your patient that you are listening, and it creates a platform for your patient to add more information that they might need to, that they might be feeling that they want to avoid. Because we know patients, they tend to avoid certain aspects of the interview. So use your silence effectively. It can bring out more clinical information that you need. So once you've gathered all your information and you feel happy that you've understood the reason why your patient has come to see you, close off your interview effectively. So the closing off is more on the part of you as the medical professional, because you need to create a sense of recapping and reflection for the patient. So you will really lead and guide the closing part. So this is an opportunity to summarize and reflect. Summarize the main points of departure, as well as looking at the next step. So this is important because you as the healthcare professional and in the interview will make sure that your patient understands what you've discussed. It can also create a platform for you to clear up any ambiguity, identify any gaps or miscommunication. So your patient might say, right, so do I need to go to the laboratory next for my blood test, or do I go and have a chest x-ray? And so those minor things, they might seem quite simple. You can clarify the next step for your patient. Focus on the key aspects, so don't regurgitate the whole interview. Focus on the key aspects, so you can say, right, Mr. Smith, we discussed that we're going to be changing your blood pressure medication. You're going to go and have a few blood tests, and then you will have a follow-up appointment in 2 weeks. So focus on the key aspects prior to departure. And then lastly, as a professional, assess the emotional atmosphere before the patient leaves. Do an emotional check. So you don't want to close off an interview where your patient is crying, they're emotional. You may have highlighted something that is terminal, that is serious, that is has created a sense of emotion with your patient. You need to keep that in check before they leave. Or if the patient is very emotional, spend a few minutes with them just to get the emotions under control and create an opportunity to refer either to a psychologist or a social worker. So never end your interview on a very high emotional state. That would be unfair both to your patient and to yourself as well. And then you close off your interview confidently and securely. Thank you very much.
Thank you very much, Mariana. Wonderful job. And next we'll get to Sarah. So again, share your background before you talk about the post-OSCE or common feedback areas that you would like to share.
Thanks, Gabia. Hello, everybody. My name is Sarah Beckett. I've been an actor for over 30 years, and similar to Matt, for over 20 years, I've worked for the NHS in a whole variety of contexts, including covering OSCEs. So that's everything from introducing OSCEs to second year medical students, right up until advanced OSCE skills with on a one-to-one basis with psychiatrists preparing for the CASC exam. And I've also been a simulated patient in a variety of exam OSCEs. And what I'd like to cover is 5 of the most common areas that I consistently give feedback to students on following a practice mock OSCE. So number 1, your introduction. I recommend that you make your introduction short and sweet, because a disproportionate amount of time spent on the introduction means less time on other critical areas. What I mean by short is you enter the station. If it's an exam, the examiner will check your candidate number. If it's a mock OSCE, we will check your name to make sure we have the right student. Then if you greet the patient, get them to confirm their name and date of birth. So before we begin, can I just check your name and date of birth to make sure you've got the right patient? And then they will give their answer. And rather than asking a question at this point, this is very common, where a student will say, how would you like me to address you? I believe that's awkward, it's unnatural, it's creating distance, and it's a question at a time where you don't need a question. So rather than asking that question at this point, I would say, how may I call you Susan, for example? It's quick, it's polite, it's professional. It gives the patient the opportunity to either say yes or no, I'd prefer Mrs. Smith, and you've created rapport quickly. Now, most students won't use the patient's name during a scenario, but if you do, that is great for building rapport, and I'm very welcome from the part of the patient. Then you would introduce yourself and then give a broad open request for information. So what's brought you here today? As Mariana said, or I understand you're here today because ... tell me more about that. Now, up until this point, if you've followed that course of action, you will have taken less than a minute to complete the first area on the mark sheet. Now, the patient will respond to what's brought you here today. And that brings me on to point number 2, which is to encourage the patient to tell their story. After your introduction is the prime time for obtaining information that will guide you in the direction the station is designed to go in. And if you set the tone by asking closed questions early in the consultation, the patient will likely only answer yes or no. Reiterating what Mariana's already covered, but this is very common. You'll be shutting down the patient. limiting them in the amount of information that they can give you, and you're starting to decrease the rapport. So open requests for information. Tell me more about that. Think about it rather like a funnel of questioning. You start with a broad request, tell me more about that, before moving to specific areas you want to cover. So when did this start, or describe the pain, still open. And then you funnel down to the closed questions, or the either or questions. You can always start, again, a new line of questioning with an open question and then funnel down. You know, when did all this start, for example? And then funnel back down to those open and closed. So what I recommend is that you become aware of the type of questions you are asking and when you are asking them. So here's an example. If I asked you, what, if anything, relieves the pain? That's a nice, broad, open question. If I ask you, have you taken anything to relieve the pain? That is a closed, and I will respond with a closed answer. Point number 3, empathy. I suggest if it's genuine, express it. If it's not, leave it. An empathic statement bolted on reads as disingenuous and takes away from your rapport building. Statements like, I'm sorry to hear that, work well if you're comfortable saying them. But if you find it hard to express empathy, try some alternative statements like, that sounds unpleasant, uncomfortable, or that sounds very painful. I can see you're in a lot of pain. That must be difficult, distressing for you. Or, I understand. And as you go through your journey, through your training, through your practice, think of building a collection of non-judgmental, empathic statements that you're comfortable using and that you can choose and use when appropriate. As has been previously stated, you can also use empathy and build rapport with the sound of your voice, keeping it calm, the words you use, I'll talk about that at the next point, and your body language, nodding, head tilts. I mean, women very often will head tilt naturally, men less so, keeping good eye contact, leaning forward, and attentive listening. And this is really important for an OSCE, by simply slowing your pace, especially if you know you have a tendency to speed up. And in an exam situation, when you're going from station to station, it gets speedier and speedier. So by station 8, 9, and 10, we're racing through it. If you know that's likely to happen, slow it down. Slow yourself down. Do some of those breathing techniques that Matt's been talking about. And that will demonstrate that you're composed and calm and creating an overall professional persona. Just one last point on this point. If a patient expresses embarrassment or minimizes their problem or finds it difficult to talk to you in an OSCE, reassure them. For example, it's good that you came here today. We can run some tests and investigations and find out what's happening, and then look at what treatment is going to help. That's a great way of encouraging someone to talk in a real life context as well as a mock OSCE. Number 4, language. Keep it accurate, specific, simple, no jargon, as Mariana said. Clear language delivered with compassion is key to effective communication, not only in OSCEs, but in a medical context in general. So as again, you go through your practice, heighten your awareness of the language you are using on a daily basis. If you have a tendency to put a lot of ums and ahs into your sentences, verbal tics perhaps, after a patient has spoken, you may find you say good or okay a lot. Often patients aren't, often students aren't aware that they're using those verbal patterns until a mock OSCE feedback session draws attention to it. And learning what your rhythms, your patterns, if any, are, will increase your awareness of them, which means you can work at reducing them. Sometimes, if you find yourself saying okay a lot, imagine if you're in front of a patient, real or simulated, and they're telling you, that they don't feel like life is worth living, and you say, okay, it's really not appropriate. So think about substituting some of those words that you tend to use a lot for a nod. That can work very well, or an occasionally. That encourages the patient to talk. Perhaps you use minimizing language. This is feedback I find myself giving a lot. For example, saying quite serious or a bit concerning. For me, that's rather like saying someone is quite pregnant. You either are or you aren't. It's either serious or it's something else. It's coming from a good place. As far as you're concerned, it's because you don't want to hurt somebody, you don't want to be the one giving them the bad news, but that can take away from your professionalism and muddy the clarity of the message you are giving. Also, the word chat. A chat is informal. It's good for rapport, it's good in certain contexts, but in others, inappropriate in a medical context. For example, when meeting a patient for the first time, I would suggest changing the word chat to talk or discuss, or I'd like to find out more about. For example, if I have a terminal cancer diagnosis, I do not want to chat. I want to talk to somebody about it. But if I were a vulnerable young adult who's reticent about talking, a chat might be just the right word. But if you don't know which context to use that word chat in, as I say, substitute it for discuss or talk. Finally, number 5, finishing the station. Timekeeping, summarizing, planning and closing the station. These get off, especially in the early days of practicing OSCEs. Very often a consultation will finish abruptly because the student hasn't kept an eye on their timekeeping. And as a result, when we come to the mark sheet, those last sections, we can't mark them on because they haven't covered them. What I suggest you do as good practice is at the 5 or 6 minute mark, ice the patient. Ask them what their ideas, concerns, expectations are. For example, saying, what thoughts have you had about this? Or what are you thinking this might be? This can lead you to combine summarizing and offering an explanation at the same time. So you could say, well, I agree, because you're experiencing A, B, and C, I agree, it sounds like it could be ... So I suggest that our plan going forward is ... and then finish with, how does that sound? You've then effectively begun to round off the consultation in a timely manner, but you're still keeping the dialogue open with the patient, which will allow more questions to be asked and potentially more information to be gleaned. Those are all the points I wanted to cover. I'm going to hand back to Gabia now, but if you have any questions about what we've been talking about, please ask away.
Thank you very much, Sarah, and as well, thank you, Mariana and Matt. So we're nearly there, but before we move on to our Q&A session, I wanted to talk a bit about dealing with test anxiety, as we are all aware what that feels like. We would have experienced it at some stage in our lives. However, it is especially prominent within the OSCE exam. Many students do prefer MCQs or other written exams over the OSCEs. So there is a significant difference there. Fortunately, anxiety during an OSCE declines quite quickly. So that kind of shows us that familiarity and exposure have a positive impact on nerves. So those are kind of the key words there to keep in mind: familiarity and exposure. So what are some issues if we don't look at our test anxiety? So we can actually affect the validity of the OSCE because we're not actually measuring your actual competence if you are bombarded by nerves on the day of your exam. You may not learn anything from the exam from being so nervous, and in some cases it may lead to low self-esteem, reduced sleep quality, and even in rare cases, depression. So how can we prevent that? So let's have a look at some things that increase and decrease test anxiety. So first of all, we have self-negligence. So anything including sleep deprivation, excessive consumption of coffee or other stimulants, including alcohol, Those all affect psychological perception and weakens your mental ability. So we want to look at the other skills. So we want to look at self-care, including getting enough sleep, having a balanced diet, and getting enough exercise. So that could be anything. That could be a walk, could be doing chores around the house, could be gardening, anything that kind of keeps you active. And these things maintain a healthy lifestyle while also increasing positive thoughts. So if we're moving on to positive thoughts, this is referring to believing yourself and maintaining motivation. The opposite end of the scale would be negative thoughts. So dwelling on past mistakes, constantly thinking you're not good enough. If you failed before, you believe that you will fail again. These thoughts can be overcome by mindfulness techniques such as deep breathing, like Matt would have discussed, grounding techniques, and if nothing else helps, CBT is an option as well. Now moving on to huge curricular content. So we can't do a lot, or we can't do anything when it comes to our workload, but we can organize it better. So going back to familiarity and exposure, again, keywords. Familiarize yourself with the content, identify any gaps in knowledge that you may have, and do practice questions, mock exams, whether it's anything you can find online or even peer-assisted learning. Make sure you get as much practice as you can so you're familiar with the exam, with the layout, so you're minimizing your test anxiety as much as you can. Make use of university resources like tutoring. Look into your university and see what they can offer you. And plan ahead. Ensure you know the date, time, and location of your exam. All of these are easy things that you can plan ahead that will minimize your stress. And of course, you can learn a lot from feedback received from former exams or even your classmates. And it's going to help you a lot more than criticism. Criticism is more like scolding your behavior or the way you have participated in an exam. So that's not going to help you going forward. So whether you are a student or a medical professional, it's important to keep these points in mind. So our feedback should be specific. It should include detailed information of what was done well or poorly. So simply saying that the introduction was good isn't specific enough. We want to say that the doctor introduced themselves, they greeted the patient, and they confirmed their name. So that is a specific analysis of a good introduction. So it should also be balanced, meaning that it should contain both positive and negative comments. So we don't want it to be all negative, and it may disempower the patient and put them off, or the student, I should say. And we don't want it to be all positive, because we want it to be a learning experience, and we want to give pointers on where the student can improve. The feedback should be behavioral. It should focus on observed action that is seen in the exam. So we're not focusing on their personality, we're focusing on simply what we saw in their exam. So saying the student showed empathy as opposed to saying that the student was empathetic. We're only judging their performance. And it should be constructive, supportive feedback that identifies a solution to the area of weakness that they may have. So saying something nice followed by where they could improve next time. It should always aim to guide learning and help their future performance. And if we move on, this kind of image here puts it all together for us. So we have the bubble of anxiety there in the middle. So if we look to our left, we see previous experience with an OSCE and gaining knowledge and skill all decrease anxiety while increasing performance. So again, familiarity and exposure are very important. The more you are familiarized and exposed to an OSCE, the less anxious you will feel, because you kind of know what's coming already. But also you have to have that knowledge there before you sit an OSCE. So you have to know what you're talking about in the first place. So preparation and planning ahead, that's what we talked about just there. And then moving on to the right side, we have poor interpersonal skills. So our communication skills, what we've been talking about all along, and perceived gaps in theory and practice. So very important. If we don't know what we're talking about, if we don't know how to speak to our patient, then of course our anxiety is going to increase, because we're not going to know what's going on. We're not going to gather all the information that we need to come up with an appropriate diagnosis. And again, perceived gaps between theory and practice. We have to familiarize ourselves with the exam, with the marking rubric. As much information that we have about the exam, the less anxious we will feel. And self-efficacy is in there as well. So that's relating back to our positive thoughts. If we believe in ourselves and believe we can do well, that will impact our performance as well. So overall, do remember that anxiety is normal, and it helps to sharpen your mind and focus your attention, and it'll encourage you to study and prepare better for your next exam. So a little nerves is nothing to be worried about. And I just wanted to leave this quote there as well for you guys. So moving on to our Q&A, if you have any questions, pop them in the comment box, or you can put up your hand, whatever you feel comfortable with. And then our next slide there will be our discount code as well for any of those who would like to participate in a mock OSCE. So thank you to our guests, our actors, and thank you for anyone who has joined today. There we go, that's our code there for anyone who would like.
I'd like to ask the first question that came in from Thomas Cropman's. What, according to the expertise, could schools of medicine do to further improve practicing these communication skills? So, again, to anybody, is there anything that we think that schools of medicine can either incorporate or practice to enable further development of communication skills?
Yeah, absolutely. I think doing it from year one is the most important thing. I mean, when I've got involved, it's always been third year and onwards. I think doing it from year one so that people get used to practicing the communication skills, so it becomes second nature. So they're not sort of rabbits in headlights when it comes to actually dealing with real people. And having actors coming in and simulating patients is hugely valuable, because it encourages people to get used to working with people they're not familiar with. It's not their mates playing a role, or they're not just got their head in a textbook. Actually having to stand up in front of people and talk is a huge part of it. So I think the more that happens and the earlier, the better.
Thank you, Matt. One more here for the actors. What would be your response if you came across a really nervous student doctor?
It would be dependent on whether it was a mock, it was a practice, or whether it was an actual exam. Because in a practice exam, we can give you clues and encourage you and help you along. It's important that it's a productive, you gain from doing it. So we're not going to be obstructive and difficult in a mock, in a practice. On the contrary, we will try to help you and give you clues to encourage you to question us. But in an exam, we will just sit there and watch you suffer, I'm afraid. There's not a lot we can do about it. There's an examiner watching. But if you are in an exam, what I would suggest you say, even in real life practice, it is fine to stop and say, I'm just going to take a couple of minutes and see if there's anything else I should be asking you, and then refer back to your notes or have a think inside. And your patient, simulated patient, will wait. Your real life patient will wait as well. If there's, if you're just checking to see if there's anything else I should be covering, nobody's going to give you a hard time about that. Nobody's going to be saying, well, you should know exactly what you're supposed to be asking me. It is human. You are humans and we are as well. So yes, there is a difference between the practice and the exam.
Yeah, and then just to add on to that, Sarah, I agree with you. You know, just be honest. Say to your examiner, I mean, I have been an examiner and I've encountered many nervous students. And so just say, can I just take a few minutes just to gather my thoughts, take a deep breath. Breathing exercises work really, really well. Have a sip of water just to gather yourself, compose yourself. And honestly, it really works wonders. From an examiner's point of view, what we often say to a student if they're very nervous, we can see they're very anxious, is just go back, read your instructions again. If they are able to, we encourage them to highlight on the instructions if they can, or just read the most important words that stand out and just read it again. And read the task at hand. So that just gathering their composure makes a big difference for a student.
And I would also just add on to that, even if you've ended your consultation early, this is in an exam, I would suggest many students will leave the station. And once you've gone, that's it. If you suddenly remember a question once you've left the station, it's too late. But if you sit in, if you wait in there until that bell goes, you can always, if another question springs into your mind, you can ask it and that patient will respond.
Thank you. Any other questions?
Maybe Kelvin, I've one more question. What is the, and thank you very much, by the way, for a very interesting webinar. What, according to your experience as an actor, is the worst that you have seen happening with examiners influencing the performance of a student?
In an exam, the worst, all I will see is that the examiner has very clear instructions, as does the simulated patient, in that they can only invite the examinee to refer back to their instructions. There's nothing else they can offer. They might, offer them to have a drink of water with me, but they can't, because of it has to be fair for all. They have to offer the same for all. They can't be seen to be giving preferential treatment or encouragement to any one particular student. So that's all they will offer, is to refer you back to your instructions.
Thank you, Sarah.
Yeah.
Does anybody else have any questions? Feel free to type them in. You don't need to speak. We have a few more.
We have a very quiet audience, Gary. I think we can kind of wrap it up there.
Okay, this was all recorded anyway, so anyone that has been here today, you'll get a copy sent out to you, so you can look back at the notes and all the tips that we've got, and all the references are there as well, from the previous slides if anyone is interested. So again, thank you everyone for being here. I hope you've learned something from today, and again, thank you to our lovely actors. And thank you for Kelvin for moderating the slides today. So we hope to see you soon, and host another one of these webinars. And best of luck with your studies or your work.